Welcome back to your Pediatric Dentist channel Tiny Teeth Talks. If you are new to this channel, subscribe the channel, and for details of this channel visit the bio section, or you can also check out my first video. Sorry if there is any mistake in videos or shorts. Today we will discuss the theories of tooth eruption. These theories help in diagnosing and treating conditions like delayed eruption, impaction and ectopic eruption. In children, knowledge of eruption patterns and the underlying mechanisms helps guide early interventions for malocclusion and other developmental issues. So I will cover 13 theories in two parts. If I missed out any theory, tell me in the comment section. I will explain later. Starting with the first theory, root elongation theory. It suggests that the elongation of the tooth root generates a force that pushes the tooth upward into its functional position in the oral cavity. So dentin and cementum are deposited at the apex and root elongates. The alveolar bone resorb above erupting tooth and forms below it to accommodate the elongating root. So because of elongation of the root, there is a alveolar bone resorption above the erupting tooth and formation of the alveolar bone below it. The elongation of the root stretches the periodontal ligament, which may contribute to the eruptive force. So basically, there is a deposition of dentin and cementum at the apex, resorption of the alveolar bone above the erupting tooth and formation below it due to the elongation of the root, and this elongation of the root stretches the periodontal ligament, which may contribute to the eruptive force, which leads to the eruption of the tooth into the oral cavity. So of course there is evidence that root of the tooth elongates as crown erupts into the oral cavity, but there are rootless teeth often erupt without the concomitant elongation of the root. Also, submerged teeth often continue to the formation of their roots but do not erupt. So this theory is not the one responsible for eruption of the tooth. So coming to the second theory, which is pulpal constriction theory. So the theory proposed that the growth of the root dentin and the subsequent reduction in pulp chamber size generate pressure, which contributes to the occlusal moment of the tooth. There is a root dentin growth, and due to this there is a constriction of the pulp chamber, which cause the internal pressure in the pulp chamber, and this pressure from the pulpal constriction may interact with the periodontal ligament and alveolar bone, facilitating the eruption process. So of course there is evidence that histological studies have shown that as the root dentin grows, the pulp chamber become progressively smaller, and this observation aligns with the idea that pulpal constriction could contribute to eruption. But teeth that have lost their pulp due to the trauma and endodontic treatment still erupt at normal rates. This challenges the necessity of pulpal constriction for eruption. So pulpal constriction might help in the eruption, but there are multiple other factors responsible for the eruption. So let's go to the third theory, which is the growth of the periodontal tissue. So in this there are two theories. First, there is a Underwood's theory, and the second is Herman's theory. So let's understand first Underwood's theory. So Underwood suggested that the connective tissue, here are the connective tissue. Underwood suggests that the connective tissue surrounding the developing tooth could generate the tensile force, which effectively pull the tooth towards the oral cavity. So according to this theory, the periodontal fibers along with the associated connective tissue matrix act like an elastic band that pulling the tooth into its eruptive position. But some histological studies reveal that the periodontal fibers are oriented in a way that they are being pulled by the erupting tooth rather than exerting a pulling force themselves. So this contradicts the theory's premise. Then the second is Herman's theory. So Herman's proposed that the growth of the alveolar bone pushes the tooth into the oral cavity by the process of remodeling. So there is a bone formation below it and the bone resorption above the erupting tooth. So Herman proposed that the growth of the alveolar bone could push or squeeze the tooth out of its alveolus in the oral cavity by remodeling of the bone. The resorption of the bone above the tooth crown would clear a pathway, while the new bone formation around the root apex was thought to create a squeezing or pushing force that propels the tooth upward into the oral cavity. But X-ray and histological sections show that the bone does not actually touch the tooth. In addition, this mechanism can operate only upon single conical root but not on multi-rooted teeth. The complex morphology and spatial arrangement of the roots in the multi-rooted teeth make it impossible for the bone growth to exert a uniform pushing force. So coming to the fourth theory, which is pressure from muscular action, which is proposed by Burton. So the musculature of the cheeks and lips exert the pressure on the alveolar process, effectively squeezing the crown of the tooth out into the oral cavity. So there is a continuous pressure of the cheek and lip which is responsible for the tooth to erupt into the oral cavity according to the Burton. This mechanism is linked to the action of squeezing a pumpkin seed between the fingers. The theory poses that this muscular action continues until the tooth reaches occlusion, where it is halted by the antagonistic force of opposing teeth. But studies on the patient with the unilateral facial paralysis, such as those caused by the Bell's palsy or other conditions affecting the facial nerve, have shown no significant difference in eruption patterns of the teeth. So without the pressure of cheek and lips, the tooth erupts. So coming to the fifth one, which is resorption of the alveolar crest. So this theory proposed that the resorption of the alveolar crest, the bony ridge surrounding the tooth, create the space for the crown to emerge into the oral cavity. It was assumed that the breakdown of the bone at the alveolar crest would facilitate the upward movement of the tooth, but examination of the alveolar crest revealed that it is a site of rapid and continuous bone growth, not resorption. Bone remodeling at the crest involves both resorption and deposition, but the net effect is often bone formation rather than the loss. Coming to the sixth theory, which is hormonal theory, Sir Arthur Keith suggests that hormones secreted by the thyroid and the pituitary glands influence the process of tooth eruption. So hormones such as the thyroxine, which is secreted from the thyroid gland, and the growth hormone, which is secreted from the pituitary gland, are known to regulate growth and development in the body. Their influence on the bone growth, metabolism, and cellular activity suggest a potential role in tooth eruption. So thyroxine, which is secreted from the thyroid gland, is involved in regulating metabolic activity and bone remodeling, both of which are critical for the eruption process. And the growth hormone, which is secreted from the pituitary gland, stimulate the production of the insulin like growth factor 1 IGF-1, which promotes cell proliferation and differentiation in the bones and soft tissue. But the hormonal theory does not explain the localized site-specific mechanism of the tooth eruption, such as the role of the dental follicle, alveolar bone remodeling, or periodontal ligament maturation. So hormones are systemic factor, and while they may influence the overall growth and development of the jaws and teeth, they are not the primary drivers of the eruptive process. So summary till now, root elongation theory suggests the deposition of the dentin and cementum initiate root elongation, which cause the resorption of alveolar bone above and deposition below, and stretches the periodontal ligament that cause the eruptive force, which pushes the tooth into the oral cavity. Pulpal constriction theory, that is the growth of the root dentin, which cause the constriction of the pulpal chamber, generate the internal pressure, and the pressure interacts with the pedial and alveolar bone, which facilitates the tooth eruption. Then the growth of periodontal tissue theory has two concepts. According to Underwood, surrounding connective tissue generate tensile force and pull the tooth into the oral cavity, and according to Herman, bone remodeling process cause the resorption above and deposition below, pushes or squeeze the tooth into the oral cavity. Then the pressure from muscular action, so the pressure from cheek and lip squeezes the tooth into the oral cavity, and opposing tooth will stop the eruption. Then the resorption of alveolar crest, so the resorption of alveolar crest creates space for crown to emerge into the oral cavity. And the hormonal theory suggests that the thyroxine from the thyroid gland regulate metabolic activity, and remodeling and growth hormone from pituitary gland produce IGF-1 factor promotes cell proliferation and differentiation, facilitates tooth eruption into the oral cavity. Some of the theories are contributing to the eruption process but can't facilitate alone because the eruption is a multifactorial process. Remaining theories will be in the next part. If you want this PDF or any other PDF, just like, subscribe, and comment your mail ID with the topic, and I'll send you the PDF. New videos on Sunday or sometimes Thursday and Sunday. Also, we try to put MCQs according to topic on our shorts with the answer and explanation if needed, which will help you in Viva or NEET exam. Like, share, and subscribe the channel. Thank you.